Good day everyone, I am Zara Macy Diliza and today I will be doing the wound dressing procedure. A wound is a disruption in the normal integrity of the skin and underlying tissues. It may be caused accidentally or intentionally. Trauma may produce a wound that is opened or closed, clean or contaminated, and superficial or deep. Care of the client with a wound is a fundamental aspect of nursing care that requires skills and knowledge. The purpose of this procedure is to remove drainage, debris, and microorganisms from the wound. It is also to promote wound healing, absorb drainage as it accumulates, provide a barrier against the entry of contaminants from the wound, and also from any additional injuries. The materials needed will be sterile gloves, gauze dressing, sterile dressing set, cleansing saline solution, clean disposable gloves, a plastic bag for the soil dressing, hypoallergenic tapes, and also bath blanket.
For the assessment, we check the orders of the doctor for the dressing change by reading the chart for information that reflects the development of possible complications. We will check the current dressing on the client before changing it to a new dressing. Also, check the availability of supplies to determine what is not available and have it requested. Gather the materials and organize it for efficient time management. Before meeting the client and beginning the procedure, we must first perform hand washing to reduce the number of microorganisms on the hands and the risk of infection to the client's wound. Then we identify and explain the procedure to the client to encourage them to cooperate and reduce their nervousness. Close the door or curtain to provide privacy to the client, and assist them to a comfortable position that provides easy access to the wound area. Place an open cuffed plastic bag near the working area where we will dispose the soil dressing and the other materials that we will use. Loosen the tape on the dressing before putting on gloves. If the tape is hard to remove, apply a small amount of sterile saline solution to the tape to make it easier to remove. After loosening the tape, don a clean, disposable glove and remove the soil dressing. The glove protects our hands from contamination. Then, assess the wound or the amount, type, and odor of drainage and document the progress. Discard the soil dressing on the plastic bag and pull off gloves from inside out and discard it on the plastic bag also. Then, we will perform a thorough hand washing since we will be handling sterile dressing equipments. After hand washing, open the sterile dressings and supplies and be mindful of the aseptic technique when doing so. Open the sterile saline solution and pour it over. Then, we will don sterile gloves so that we can handle sterile objects freely without contaminating them, and also to prevent transmission of infective organisms. Now that we have our sterile gloves on, we can now cleanse the wound using the sterile forceps. Cleanse from top to bottom or in a widening spiral motion from the cleanest to the most contaminated. Use one gauze square or a cotton ball for each wipe. If there is a drain, cleanse around it in a circular motion. Dry the wound using a gauze square in the same motion. Apply a layer of dry, sterile dressing over the wound using the sterile forceps. Apply sterile gauze under and around the drain if one is present. Apply the second layer of gauze to the wound site. Then apply the third layer of gauze as the outermost layer. Pull off the glove inside out and discard it in a plastic bag. Be careful that the contaminated area of the gloves will not touch the skin to avoid contamination. Apply tapes to secure the dressing in place. The tape is easier to apply after gloves have been removed. After securing the dressing, tidy all the equipments and the materials that was used and make the client comfortable. Then wash your hands after to prevent the spread of microorganisms. For the documentation, always make sure to record the dressing change and appearance of the wound and describe any drainage in the chart. Check the dressing and wound site every shift.